In this video, I'm going to talk about a simple exercise that we covered on how you can rehab your knee and get some of that proprioception back to reduce the likelihood of you injuring again in the future, and some easy principles that you need to adhere to when you are going through this rehab. So hopefully you're going to find it really helpful. This actually follows on from a live stream that we did a little while ago on knee pain and how you can resolve it, and there'll be a link probably somewhere up here to the card which will take you to that live stream, or you can just go onto our YouTube channel to find it. Hopefully it's going to make a good bit of sense, and give it a go. It's a really easy exercise. It's called the clock face, and that's essentially where we are starting to work on the proprioception of one leg by tracing out the times on a clock face. So hopefully it's going to be really helpful. It shouldn't be too much of a challenge for you, and if you're struggling in terms of balance or those sorts of things, then you can always use the support. When should you be doing this exercise? Well, not immediately after you've injured the knee, especially if it's been a more severe injury. But as you start being able to weight bear and being able to get a little bit of a bend on your knee, that's going to be the time to start to restore some of the connection between these muscles and your brain. Now, alongside this exercise, we should also be doing some strengthening exercises. Those might mean some minor squats, etc. And we'll cover those maybe toward the back end of this video as well, to give you guys a bit of an idea. So, firstly, if we look down at my feet on the camera, first and foremost. So, you can see down here, what we're essentially doing is we're putting our foot in the middle of the clock face, slight bend in the knee, so you guys can see that there, one bend, and then we can always hold on to something like I mentioned a moment ago, and all we're going to do is slight bend, and we're just going to trace out, you can go whichever way around you want, the clock face. And you can see my foot's making some small adjustments as I'm doing this. This actually, interestingly, is a great one for the ankle as well. So if you've got ankle sprains, you can throw this one in there as well. And we just go around the clock face, all the way to the back, and then we come to the front, and we start coming over here. These are going to get a little bit more difficult, coming around as far as we can, and around as far as we can, because we're having to use these muscles with the hamstrings, with the calves, with a sense of balance to really try and work on it. This floor here is a little bit wonky, so it's a little bit more difficult still. And again, same like slight bend in the knee. We don't want the leg locked out, otherwise we're going to disengage our muscles. So we want a slight bend in the knee again, and then we're going round here, going round through that clock face, etc. as we go around. And you can play around with it. Maybe you find over here is a little bit more difficult, and reaching around here is a little bit more difficult, so we can work on those ranges. Or maybe as you're just starting, even standing on one leg is hard enough. So we start just by doing the simple clock face there. If we bring the camera back up, so this is a great one. You can go around, maybe you do 10, 15 reps on each one, working on some of those more difficult ones. You've got a support there that you can help yourself with so that you don't fall over. Last thing you want is you falling over. So maybe do it in the kitchen where you've got some support, but you can do this one anywhere. And it's important to remember, when we talk about exercises, we talk about those sort of relief or skill-based exercises, which we can't do too much of. We can do them frequently, but they're not getting us stronger. And then we also talk about the strengthening exercises. This one falls firmly in the category of the skill-based. We're restoring some neurological connection. We're helping those muscles work in a more proprioceptive way. So that's really, really important. We're not really going to progress the reps of this. It's just something we're going to do on a regular basis to restore that connection. And the normal acts of daily living, going up and down steps, moving, carrying things, will also serve to stimulate this, but it's a bit more of a direct way of challenging that balance. And as we get older, it's something that's really, really important, especially if we're at risk of falling and those sorts of things. So please do give this one a go. It's suitable for more or less everybody. You just may need a little bit more support if you're a little bit more nervous on your feet, but it will help anyone restore that connection between here and the injured leg. Now, if we move over to some of those other exercises we discussed in the live stream as well, that door squat. This would fall under the category of strengthening. And what we're doing here is holding on to the door frame for a little bit of support. Maybe some of you getting up and down out of a chair, maybe this is actually really difficult. The chair is too low. You know, we go down here and getting up is enough of a stimulation for our legs. So we need to start off with something with a bit more support to begin with, so we can progress on to maybe a free weight squat, for example. So we come over here to the door, we hold on to the door frame, we slowly squat down. Maybe that's as far as we can go, and come back up. If you've got knee pain, you want to be very careful. Imagine we've got a line here, which is our tibial plateau. This is the top of our lower leg bone. We want to set up a nice base of support. If our knees are going forwards, that support is wrong. we've got a shearing force now through the knee, which is going to hurt your knees. So one of the other reasons that we recommend this one is because you can get really close to the wall and you can sit back, and now I'm still nice and supported in this position here rather than getting my knees going forwards. So very, very safe one for the knees if we've got cartilage issues or ligament issues in there. So coming down, and maybe we're doing 5, maybe we're doing 3, maybe we can do 10, whatever it may be. This is a strengthening exercise. And then we progress on later on to the chair. We'll start doing squats up and down out of the chair. Maybe we do some with the legs wide. Keep our core engaged, come down, and then back up again. Maybe we do some close to work some of the other muscles. Come down, and then we come back up again. And we build this out. Some final little tips for the squats. You can use a few cushions on there so that you're not having to go quite as low. But same as any other exercises that we've recommended, use that treat protocol, the testing way. So what we do is we test a new depth of squat. We rest, maybe the next day, we have the rest of that day off. Next day we're going to have a look, we do normal stuff the rest of that day, nothing else abnormal. We rest, we then evaluate, how am I today? Has it irritated my knee too much? Maybe the knee was a little bit sore immediately after the exercise, but then it settled down nicely and we're none the worse the next day. Evaluate in the context of the normal day-to-day pattern. So if your knee's always sore during the day and it's sore the day after you've done that new exercise, well, that's normal for you, so nothing has changed. We can then adjust, so if that was the case, we wouldn't need to adjust anything. And then we test again. Maybe in a couple of days, a couple of weeks, we then go a little bit lower again. And that is the way you can build your knee rehab. The clock face that we discussed at the start of this video isn't really going to be an issue. With this one, you just do it safely and sensibly, but those strengthening exercises, we do need to push the boat out. It's really important when it comes to knee rehab. Again, that card earlier up, somewhere up here, or in the description, you can go and watch that full live stream that we did on the knee pain and how to rehab it. So hopefully it's been helpful. If it has, make sure you hit the like button, make sure you subscribe to the channel. We do our live streams. If you didn't know, every single weekday, it's your opportunity to ask us questions, get a little bit of help, whether it's knee pain or back pain, we can help you on those live streams. Hopefully you're gonna be helpful, and have a great day. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.